Dr. Scott Oberhoff joins us. You're an allergist at Austin Diagnostic Clinic, and COVID obviously isn't the only thing going around now. There are other illnesses as well. So what are you seeing that's prevalent in our community, and what are the symptoms and how do they differ?
This summer, actually, we started to see a significant uptick in a lot of other viruses that used to be present throughout the year. Those viruses include things like RSV, rhinovirus, parainfluenza, a number of other illnesses that have caused a lot of symptoms that can be confused with COVID. So the symptoms can differ chiefly on some of the presentations. So some of these viruses cause more runny nose, some of them cause more body aches, some of them more cough. So it really depends on the virus that is there, but a lot of the problems come when they really give the same basic set of symptoms.
How do you distinguish allergies or COVID?
So one of the big distinguishing factors between allergy and most viral illnesses is itchiness. If you have a lot of itch going on, itchy eyes, itchy ears, itchy nose, sneezing attacks, these tend to be more associated with allergy. If there is a fever involved, despite the names of cedar fever and hay fever, fever is a very, very uncommon symptom of allergy. So if you have fever, that is usually indicative of a viral or bacterial infection.
You see patients that present symptoms that think they are allergies, but it's actually COVID?
We have, and we've seen some of that with the vaccinations that have taken place with COVID. For a lot of patients, that really attenuates some of their symptoms. And so it can be very difficult to discern what exactly is allergy and what is COVID and what are other viral illnesses.
Can allergy sufferers see some benefits wearing masks outside?
The literature has been kind of quiet on this until recently. There was actually a study done in Germany, and what they found is that patients who wore different types of masks actually did have some protection from at least grass pollen that was out there.
Thank you so much for the information. Dr. Scott Oberhoff with the Austin Diagnostic Clinic. Appreciate you joining us today.